Have you consulted your doctor recently over a phone call or video conferencing? Well, if you have, then you sure have experienced telemedicine. With the increase in COVID-19 cases and the new norms of social distancing, it may not be an exaggeration to say that telemedicine is sine qua non to healthcare service, and more so in reaching out to the needy in remote locations with limited medical resources. Here's a video on what you should know about telemedicine in India. Put simply, telemedicine is the use of information and communication technology to provide healthcare to patients. In India, the Telemedicine Practice Guidelines of 2020 provide certain professional norms that need to be followed by medical practitioners. The guidelines has adopted the definition of telemedicine as provided by the World Health Organization. So, telemedicine is all about the delivery of healthcare services where distance is a critical factor, using information and communication technology for exchange of valid information, for diagnosis, treatment, prevention of disease and injuries, research and evaluation, continuing education for healthcare providers, and all in the interest of advancing health of individuals and their communities. Here are some important points you need to consider regarding telemedicine. Telemedicine consultation should not be conducted in anonymity. That is, both patient and the registered medical practitioner must know each other's identity. Every registered medical practitioner should display the registration number accorded by the State Medical Council or the Medical Council of India on all prescriptions, websites, electronic communications, etc. Most importantly, patient consent is necessary for any telemedicine consultation. It may be an implied or explicit consent. If the patient initiates the consultation, then it's an implied consent. And if it is made by a healthcare worker, registered medical practitioner, or caregiver, it's an express consent. Also, it may be a first consultation or a follow-up consultation. If the condition of the patient merits emergency intervention, the objective would be to provide in-person care at the earliest. But telemedicine may be adopted to advise first aid, counseling, facility referral, etc. The telemedicine guidelines require doctors to maintain the same standard of care towards a patient during a teleconsultation as they would during an in-person consultation. Consultation between patient and registered medical practitioner may also be made through a caregiver. This is mostly in circumstances where the patient is a minor or incapacitated for reasons like dementia, physical disability, etc. The caregiver is deemed to be authorized to consult on behalf of the patient. The doctor must provide photo, scan, or digital copy of a signed prescription or e-prescription to the patient via email or any messaging platform. Technology platforms providing telemedicine are obligated to ensure that the consumers are consulting with registered medical practitioners who are duly registered with the National Medical Council or respective state medical council and comply with the relevant provisions. Technology platforms based on artificial intelligence or machine learning are not allowed to counsel the patients or prescribe any medicine to a patient. Only a registered medical practitioner is entitled to counsel or prescribe and has to directly communicate with the patient in this regard. Well, the Insurance Regulatory Authority of India has clarified on this through their guidelines on telemedicine dated 11th June 2020. The authority has advised the insurers to allow telemedicine wherever consultation with a medical practitioner is allowed in the terms and conditions of the policy contract. Do check your insurance policy if this is covered. Tip number 1. Find a conducive place where you can interact without distractions and noise. Tip number 2. Ensure a good internet or mobile connectivity. Tip number 3. Provide the right and accurate information to help the medical practitioner serve you better. Tip number 4. Keep your previous records handy. If you are registered with a hospital, keep the hospital reference number ready while you book your appointment. Lastly, tip number 5. Write down your questions or clarifications before your appointment. Telemedicine is a great way to get the care you need from the comfort of your home. Making sure you're well prepared for your call and that you provide the right and accurate information can make it a satisfying experience. Thank you for watching the video. If you found it informative, don't forget to like, share and subscribe.